Hey everybody, this is Dr. Medicine RX, and in today's video we'll be discussing about Fabry's disease, also called as angiokeratoma corporis diffusum universae. So it is an X-linked recessive disorder that is characterized by the occurrence of angiokeratomas, cardiovascular episodes and renal failure. Coming to the etiopathogenesis, the enzyme deficient here is alpha galactosidase, or also called as ceramide trihexosidase, and this leads to the accumulation of ceramide trihexoside, which is a neutral glycosphingolipid in the lysosomes of various viscera. Coming to the clinical features, this disease mostly is seen in males. Coming to the clinical features on skin, the lesions they occur before puberty, and the initial lesions are dark red, black, telangiectatic, punctate, macules or papules of 0.1 to 4 mm size. They do not blanch on pressure and they tend to appear in groups. Their number and size increases with age, and they occur all over the body, such as the limbs, axillae, buttocks, lower trunk, scrotum, shaft of penis, etc. So they are most numerous at midline of lower lip, and mucosa of mouth and conjunctiva is also involved, and the fingernails they have a turtleback configuration. Coming to clinical features in eye, asymptomatic horror-like corneal opacities, that is corneal verticillata, are the most frequent finding, and posterior capsular deposits with branching radial patterns. Retinal vessel tortuosity and upper eyelid edema is seen. Coming to some of the other features, so all the systems that you can imagine will be involved because of this infiltration of this glycosphingolipid. So the episodic neuropathic pain occurs, which is present between the age of 5 to 15 years, and it affects the skin of fingers and toes, and it is worsened by hot weather. Vasomotor disturbances occur due to involvement of autonomic nervous system, and hands may be blue, blanched or flushed, and the skin is lax, and it can be an or hypohidrotic. Then coming to the involvement of musculoskeletal system, mild arthritis of terminal phalanges can occur. Then GIT is involved in the form of acute abdominal pain. Cerebrovascular attacks occur due to multifocal involvement of small vessels, and involvement of renal system can be seen in the form of albuminuria and hematuria because of the glomerular vessel infiltration. In respiratory system, there can be obstruction of respiratory tract because of the involvement of the epithelial cells, and lungs can be affected. Then cardiovascular episodes also occur. Coming to prognosis, death is seen in 3rd to 4th decade due to vascular involvement of renal failure. Otherwise, we can expect a prolonged lifespan. Coming to the investigations, clinical diagnosis and skin biopsy on light microscopy shows lipid droplets in endothelium, which can be stained with Sudan black, and they appear doubly refractor or birefringent with a polarizer. On electron microscopy, inclusion bodies with lamellar organization are seen intracytoplasmic, and on renal biopsy we can find similar infiltrative findings. Urinary sediment shows birefringent lipid containing cells. On urine examination there is albuminuria, and on polariscopy there is Maltese cross appearance of the material with mulberry cells, which are glycolipids. There is decreased levels of plasma alpha galactosidase A, and cornea verticillata can be examined using slit lamp examination. Coming to management, renal transplant is necessary in case of renal failure. However, in the new graft as well, renal complications can occur, and for pain we can go for phenytoin and carbamazepine. Aspirin may reduce the chances of stroke and cerebrovascular attacks, and enzyme replacement therapy can be tried but has many side effects. Angiokeratomas can be removed by laser therapy. Thank you. Subscribe for more.